Hey guys, welcome back, and in today's video we are going to be dissecting care plan for Alzheimer disease. But before we do that, I am going to be reading the scenario I use for the A to E assessment of Alzheimer disease. The patient name was Ellie Brooke. The patient date of birth was 15 February 1940. The patient hospital number was 10010. The patient lives at 2 Norman Road, Dartford. And the patient GP is Dr. Syme, Westview Cross Surgery. The date of visit is today, 6 o'clock. Now, the presenting complaint. Ellie Brooke is in the community looking very unkempt, refusing to eat, kept food in the fridge for over 4 months, left her gas on, cannot perform most of her activities of daily living. She's so anxious, she's so unsettled, and she's complaining of headache with a pain score of 7 out of 10. Her daughter lives with her and assists her with activities of daily living. She has a past medical history of arthritis, hypertension. Social history, she lives with her daughter, and she's a non-smoker, but she drinks every morning. Her drug history is she's on citalopram and donepezil, and she's allergic to she's allergic to peanuts, and the reaction is rash. Now, the first care plan we are going to be considering is number one. Before that, we did the 6 CIT score, and Mrs. Haley was having a 6 CIT score of 17, and we said 6 CIT score of 17 is significant cognitive impairment. All right, so without wasting time, out 4 care plans peculiar to Alzheimer disease. Number one, the patient was having headache. So Haley is having headache with a pain score of
Ryan Little.
Hi guys, so I'm going to be listing out the care plans for Alzheimer disease. Now, this patient we assessed had pain with a pain score of 7. On the exam day, it could be 5. So Haley is having headache, or Haley is experiencing headache due to Alzheimer disease with a 6 CIT score of 17 and a pain score of 5 out of 10. Sick. Fantastic, lovely care plan. Haley is experiencing headache due to Alzheimer disease with a 6 CIT score of 17. Don't forget, when we assess the patient for cognitive impairment, she had 17. And a pain score, she complained of pain of 7. On the exam, it could be 5. Then with a pain score of 7 out of 10. Aim of care. Ellie will verbalize relief of pain with a pain score of less than 2 out of 10. Now, re-evaluation date. Alzheimer disease is in the community. It is not in the hospital. So, re-evaluation date in any community setting will be today. Bracket open and close. Write the date of your OSCE exam, comma, daily, comma, weekly, comma, monthly, comma, and as the clinical condition changes. Now, E, explain all care to Haley and gain consent. Tick. M, monitor and record Haley's observation. How frequently? Our new score was 0. So when we assess the patient, so monitor and record Haley's observation 12 hourly and escalate as per news 2 policy. A, assess Haley for any sign of headache or any sign of pain using the pain assessment tool. C, teach Haley deep breathing exercises and repositioning, of course, for comfort. Administer all prescribed medication and monitor its effectiveness after 30 minutes. Refer Haley to WHO pain management team. Refer Haley to mental health team, and refer Haley to psychiatry team. Inform Haley to call 999 or 111 or call the GP. Then document all care plan. Fantastic care plan. Give it a tick. Tick. Now, number 2 care plan I would love to use is Ellie is at risk for malnutrition due to Alzheimer disease with a 6 CIT score of 17. Tick. Aim of care, Ellie will have improved nutritional intake, or Ellie will verbalize improved nutritional intake. Tick. Re-evaluation date in any community setting remains today. You write the dates of your OSCE exam, daily, weekly, monthly, and as the clinical condition changes. Immutare makes your care plan beautiful. E. Explain okay to Haley and gain consent. M. Monitor and record Haley's observation. Our new score was 0, 12 hourly, and escalate as per news 2 policy. A. Assess early for any sign of malnutrition, e.g., loose ring, loose band, muscle wasting, apathy. T. Teach early to eat small food at regular interval. Administer all prescribed medication and monitor its effectiveness after 30 minutes. Refer early to who? To dietitian, mental health team, psychiatry team, all right? Inform early to call 999 or 111 or GP if need be. Document or care plan. Tick! Fantastic second care plan. Now, number 3 care plan is early is at risk of self-care deficit due to Alzheimer disease with a 6 CIT score of 17. Why? When we assess this patient's cognitive impairment, the patient had a cognitive impairment score of 17. So Ellie is having or Ellie is experiencing self-care deficit due to Alzheimer disease with a 6 CIT score of 17. All right. Now, aim of care, Mrs. Ellie will participate in her self-care activities within the limits of a disease condition. Re-evaluation dates today. Write the dates of your OSCE exam, daily, weekly, monthly, and as the clinical condition changes. E. Explain all care to Ailey and gain consent. Tick. M. Monitor and record Ailey's observation 12 hourly and escalate as per news 2 policy. Assess Ailey for any resistance to performing activities of daily living. T. Teach and assist Ailey in carrying out activities of daily living while avoiding dependence. All right. Administer all prescribed medication and monitor its effectiveness after 30 minutes. Refer Ailey to who? Mental health team, occupational therapy for possible package of care. Inform Ailey to call 999 or 111 or GP if need be. Document all care planned. Tick. Now, final care plan. I just might not explain this one is Ellie is experiencing activity intolerance due to Alzheimer disease with a 6 CIT score of 17. So you can plan this on your own. Send to me. I'm happy to mark. I just don't want this video to be too long. So these are the 4 care plans for Alzheimer disease. Make sure to sign before you start your planning, and don't forget to send me a message. Does Violet, I've passed my OSCE exam, or possibly don't forget to send me a special thanks. I'll see you in my next video. Until I see you again, keep passing your OSCE exam. I love you all. Bye.